Hi, my name is Lacey Schooley, and today I'll be demonstrating a newborn assessment. So the first thing I'm going to do is knock on the patient's room, enter, close the door and the curtain for privacy, perform hand hygiene. Hi, my name is Lacey. I'm going to be your student nurse today. Can I just have you verify your name and date of birth? Okay, so I have Shirley Cost, 5/14/1964, and then she also has her wristband on with the infant number. So I'm just going to verify that all the numbers match. Okay, and the numbers match to the mom's wristband and the one on the baby's foot and arm. So I'm just going to verify that I have the right baby, and I do. So perfect. So I'm just going to be doing a newborn assessment on your baby, okay? Okay, perfect. So I'm going to put on clothes. Okay, so the first thing I'm going to do is listen to her lung fields. And for the purpose of this video, I don't have an infant stethoscope, but I would get one in a real situation. Okay, so I'm going to listen to her lung fields. Okay, and they are clear in the front, and then I'm just going to listen to her heart rate for any murmurs or extra heart sounds. I'm going to make sure to listen to a full minute just because babies do have irregular heartbeats. Okay, and so after the full minute, the heart rate was 150, which is within normal ranges. And then I'm going to auscultate for her respirations again for a full minute. Okay, and after a minute, her respirations are 50, which again is within normal limits for an infant. So next thing I'm going to do is get her temperature. I'm going to use the axillary route. I'm going to make sure that the thermometer is in the center of her axillary and it's secure. And then I'm going to hold the infant's arm to her side, hit the button, and wait for that to register. And while that is working, I'm going to just palpate her fontanelles. And both the anterior and posterior fontanelles are present. They're not bulging or sunken in, which is what we want to see. And then I'm just going to palpate for the suture lines, and they are overriding, which I know is totally normal after giving birth vaginally. Okay, my thermometer has went off, and it's 98.2, which is within normal limits for an infant. Okay. Next thing I'm going to do is just look over the baby. Her eyes are symmetrical, her ears are symmetrical, her eyes are in line with the top of her ears, her nose is symmetrical, there's no nasal flaring. Okay, so I'm just going to look at her eyes, and they're round and reactive and equal to light. And then while she has her mouth open, I'm just going to look inside her mouth at her hard palate and her soft palate to make sure that there's no holes and that it's intact, and it is, which is good. Then I'm going to look at her chest. It's symmetrical. Her nipples are symmetrical. There's no retractions or nasal flaring, which could be an indication of respiratory distress, which is good. I don't see any of that. And next, I'm going to listen to her bowel sounds. Again, I would have an infant stethoscope. Okay, and all four quadrants are active. And looking at her abdomen, it's symmetrical. Her umbilical cord, there's no redness, infection, or foul smell, or drainage. So that is good. That's what we want to see. And then just looking overall, her overall body, I don't see any bruising, scrapes, cuts, anything, which is good. Now I'm just gonna flip her over to her back. Get my stethoscope ready. To listen to her lung fields in the back. Okay, so her lung fields are clear in the back, which is good. And then I'm just going to look at her spine to make sure it's straight. And then at the bottom of the spine, make sure there's no dimpling. And there is not, so that is what we like to see. Okay. last thing I'm going to do is undo the baby's diaper. Just look for any abnormalities. I don't see any, which is good. The diaper is dry and the baby has not voided yet. So I'm just going to go ahead and leave this diaper on. Okay. Since the baby's only about 5 hours old, she hasn't voided or had a bowel movement yet. I'm going to make sure that she has a bowel movement and voids within the first 24 hours after birth. And if she doesn't have a bowel movement, then we'll check for the patency of her anus. The next thing I'm going to do is check her cap refills for circulation. Okay. And on her hands, her cap refill is good, as well on her toes, meaning that she has good circulation. I'm not seeing any signs of cyanosis. And then throughout the whole assessment, I've been observing her movements. She has full range of motion on all of her extremities. Her neck has been moving side to side. She hasn't been having any high-pitched squeals with movement of her neck, which is good because if she was, that could be an indication of a broken clavicle. So everything looks good. Let me make sure to swaddle the baby back up to keep her warm. The mom wants her left in the room for a little while longer. So I'm going to take off my gloves, make sure the mother doesn't need anything else, and I'm going to perform hand hygiene, leave the room, and then document everything I found.